Welcome back to the program, everyone. It's a great look Monday, and that means we have one of our Shatkin brothers in. We have Dr. Todd Shatkin in with us this morning, and we are talking about dental implants this morning, and he even brought a patient with him, and we want to thank this gentleman. What is your name, sir?
Mike Fennell.
Mike Fennell. We want to thank Mike for being with us this morning, and if you'll pardon the pun, for putting a face on what we're about to talk about here. Sure. Good morning, doctor. Welcome to the program.
It's always great to be here, John.
Nice to have you with us.
Thanks.
You were the forerunner in the dental implant method. Yeah. How long ago did you start this?
I started doing these, well, I've been doing dental implants since 1989 when I started in practice, but the mini dental implants came out in late 1999, early 2000, and that's when I started doing these to stabilize loose dentures, and ultimately I developed procedures which allow us now to replace missing teeth with the mini implants, single and multiple missing teeth, and we've talked about that in the past. But the mini implants are a phenomenal procedure for patients, especially people like Michael who have loose dentures.
Okay.
And you're starting to see locally other dentists and other denture clinics starting to do this procedure that I've been doing for 8 years. And we've placed over 5,000 of these mini implants with great success.
Oh my, that's a lot.
Yeah.
By the way, we want to let you know if you have any questions concerning dentistry for Dr. Todd Shatkin, you can give us a call at 644-9840, and he'd be happy to field your call. Doctor, let's talk about adhesives. They're probably on the way out. I mean,
well,
people have had to put up with that for a long time.
Denture creams and denture pastes and denture adhesives, they work. But the problem is they only last an hour or two, and you have to keep replacing it, and it tastes funny, and sometimes people have a gag problem with them and those type of things. Some people do very well with them, but really it's up to us as the dentist to educate our patients on what's new and what's available to them. So every patient that comes in the office with dentures, I have to offer them this procedure because I think it's just the most fantastic thing going for denture patients.
Has the cost of this dropped? I mean, as it becomes more pervasive?
Well, the cost of this is less than half of the cost of conventional implants. So it's significantly lower than conventional implants. And it takes only about an hour to stabilize a denture, and they can come in, have the procedure done without any surgery. There's no cutting, there's no stitches. It's done in a very simple, non-invasive procedure, and the patients leave and they can go out and eat normal meals that day.
Would you describe what a conventional implant is? What is that?
Well, a conventional dental implant, which is what we did prior to the mini implants, is a larger diameter implant. It's about 4 to 5 millimeters in diameter. It gets buried into the bone through a surgical procedure. They open the gum up with the surgery. They drill holes into the bone, and we place these in, and we allow them to heal for a period of 2 to 6 months. And at that point, after it's healed, then we go back for a second surgery. We have to open the gum back up, place superstructures on the implants, and then restore them with whatever restoration we're going to do.
Oh my goodness, that's a long, involved process.
Typically, to replace one tooth with a conventional implant takes about 7 office visits. Okay, so just to give you an idea. With the mini implants, it can all be done in one visit.
Okay,
and
that's
it can be done in less than an hour.
And before implants, if you had a tooth that needed replacing, it had to have some kind of a wire apparatus that fit around.
Do a bridge or a partial denture or something like that, and those are still out there. But in my practice, we really shy away from partial dentures. We pretty much replace the teeth with mini implants and crowns. Now, Michael, who came to me about a year ago, I believe, he had, tell him your story about your accident, your injuries, and your troubles eating.
Well, I had a construction accident. I fell 12 feet and had both my hips replaced and a shoulder. So I had 3 major surgeries within 3 years. I had a very poor appetite after that. And I had very loose dentures, and like you said, the paste, none of it tastes good. And if you're trying to eat meat, grease and stuff, and it makes it dissipate very quickly.
Yeah, I can imagine.
And you can't get up and put it in and come back and eat right away because the adhesive has to have a chance to seal.
Oh, wow.
I found out about Dr. Shatkin on AM Buffalo.
Okay, well, see, Doctor, we're serving a purpose here.
He was watching the TV and he came in.
We have a phone call if you don't mind taking one real quick.
Yeah,
good morning
pleasure.
and welcome.
Good morning.
Hi there.
I was calling to ask about the correct age to have an implant done. My son is 17.
Okay, well, we do the mini implants for children as young as 14 years of age to replace missing teeth. Many children are born without certain teeth, congenitally missing incisors, laterals, bicuspids, and we replace those as young as 14. In fact, we had a boy on that we showed that several months ago, replacing 2 lateral incisor teeth that were congenitally missing on a 14-year-old. So 14 to 99.
Now, do you choose 14 because maybe the mouth has stopped growing?
Well, what we want to do is make sure all of the permanent teeth are in the mouth. And that typically happens between 12 and 14 years of age.
Okay.
The last molars come in around 12, 13, and we want to have a stable occlusion to work with.
Sure.
And so that's why we say around 14.
You brought 3 different samples here. Are they all similar or are they different?
Well, I wanted to show what Michael had problems with his dentures, and this is a typical lower denture with 4 mini implants, and you can zoom in maybe and see that. I think they can see it pretty good. And those are the mini implant posts, 4 of these, and we put those in the lower jaw, and then we take the denture that the patient either has or we'll make them a new denture. And if you look in there, you can see, I think if I turn it the right way, you can see little O-ring housings inside the denture.
Right.
And those O-rings then snap onto the jaw where the implants are, just like that, and they become very secure.
Oh,
so they snap on and off.
Yeah, that would really, you'd have to really bite into some taffy to take that off, wouldn't you?
Very comfortable, too.
Yeah. We have another call. Good morning. Hello?
Hello.
Good morning.
Yes, good morning.
Yes, I have a question regarding, I have excellent dentures, I love them, but I have one chipped tooth on it. I was wondering generally what that costs to fix.
Oh, that's a very simple procedure. It can be fixed usually while you wait in the office, and it's less than $100.
All right, thank you very much.
All right, no
That's
problem.
amazing, Dr. Well, that's great. I was imagining you saying, well, you have to have a whole new set of dentures.
Well,
and,
if the patients are happy with their teeth, I don't like to replace them. If they're doing well with them, you know, you don't want to change something that's working.
Right.
You know. So here's I was going to show this one. This is an upper denture, and many patients have trouble with a gag reflex on their upper. And so here we've taken out the palate on the upper denture. Completely removed the palate, placed 6 mini implants in the jaw.
Yes. Okay.
And you can see those. And then the denture will snap on again.
You can hear that snap. You hear that click. Do you hear that every time you put them in, Michael?
Yeah, I put them in the morning, and I take them out at night, and that's all I have to do. The other time, I have them in and out maybe 8 times a day to put the adhesive in.
We have another call. Good morning. Welcome.
Yes, I have a question. My bottom is very, the bone has deteriorated greatly, and it's very sensitive in the front. What is involved in doing an implant like this?
Now, do you have a complete denture?
Yes.
Okay. The great thing about mini implants is that we can do this procedure on patients who've lost a lot of bone. And that's really very important because people think they're not candidates because they've lost a lot of bone. And many patients who have lost a lot of bone, like she has, are candidates. Like we mentioned, the procedure takes about an hour. It'll be a very simple procedure. You will numb your mouth a little bit. We'll place these implants in and we'll fit your denture to them if your denture is in relatively good shape. If not, we may have to make you a new denture.
Okay. Boy, doctor, this has been an education, and I think...
Well, what I want to say real quick is he had lost about 30 or 40 pounds before this surgery because of his loss of appetite and trouble, and now he's back to his pre-surgery weight and he's getting healthier, and his doctors are very happy about it. And so that was the main reason I wanted to bring Mike here to show that he's able to eat, function, and speak well.
That's wonderful. Yeah. Mike, we couldn't be happier.
I'm very happy with it.
Well, that's good. We're very happy for you. We thank you for coming today and for letting us hear your story. Doctor, as always, this was fascinating. It really is, and I hope we've helped a lot of people out there.
It's always great to be here.
Look forward to seeing you again. Thank you for being with us. Please stay with us, folks. More of our program is coming up. You'll find Aesthetic Associates at 2500 Kensington Avenue in Amherst. Their number is 839-1700. The preceding segment was brought to you by Dr. Todd Shatkin and our Great Look Monday.